Bring an infectious disease specialist, Dr. Lisa Barrett, who is in Halifax. Hey, Lisa, good to see you on this Friday.
Good to see you. Happy Friday.
You as well. So, the task force in Ontario, we know there's a federal task force being put together, other provinces following suit as well. I'm curious what you think the rollout might look like here, sort of the initial steps anyway in distribution.
Well, certainly in other places, there's a plan for small amounts of vaccine to go out, and it will depend what's first into our hands. If it's the ultra low temperature requiring vaccine, then there's going to have to be some test cases. We're going to have to roll out small amounts of vaccine first to test the system. And then as we go forward into January, February, March, again, we're really assuming here that we're going to get approvals for all these vaccines. Then there will be increasing numbers of people at highest risk first, followed by slightly lower risk as we go forward. So I do think people need to have a moment here to recognize that this is not all going to happen the minute the vaccine hits our soil. It will take a little while to get hundreds of thousands of people vaccinated.
What about the administration plan? Because I know in the case of Moderna and Pfizer, it's 2 doses separated by, 3 weeks or a month. But in
Right.
some of these other ones, Johnson and Johnson, potentially AstraZeneca, we'll see what happens with them. But that's 1 dose.
Correct. Anything that's 1 dose, we know this from many, many other vaccines. 1 dose, much easier to spread out very quickly than 2 doses. The logistics of managing the timing of a second dose, particularly within a month when you're still trying to vaccinate your first group of individuals, will mean not just that we have to keep on top of that with really great information systems, but we also need to think very carefully in this country about who can give vaccines. Our nurses are going to be very busy. Our pharmacists are going to be very busy. We're going to have to make sure we make use of both regulated and paramedicine type people to make this happen in real time.
I know you're also watching very closely about the whole issue of obligatory, mandatory vaccinations. And we heard from Ontario's top doctor there in that report that it will not be mandatory. In other words, people who don't want to get it won't be forced to get it. On the other hand, there will be limitations. For example, you want to get on an airplane, you have to have proof. You want to go to school. I mean, there's all sorts of different things where, although it's not mandatory, if you want to kind of interact in society in any way, you're going to have to show you did get a vaccine.
Right. And we have some examples in countries where mandatory or quasi-mandatory hasn't always worked. Different provinces have different thresholds. And I really do think there's going to have to be public consultation, and that's going to look a little bit different in each province. Different provinces now have different school requirements, for example, for vaccines. Going to take some consultation when we get down to that level to know what people in each different area are really willing to tolerate in terms of vaccines and who doesn't get them.
Lisa, good to see you again. Thank you for your time.